Good evening. It's such a great evening, and I'm very happy to having all these people. Maybe most of them the first time in Mongolia, and very cold season. And I hope that it's a good experience in your life to experience in the cold weather. So, and also my surgical career and medical career is spent in National Cancer Center, and before to elected as a parliament member, I was General Director of National Cancer Center. And during my directory of Cancer Center, the cervical cancer was the main goal to reduce the burden of cancer death in the cervical cancer. So in last year, 2024, we did a very tremendous work against the cervical cancer. As a start, the vaccination is a universal vaccination in the whole Mongolia. That's a big progress, I hope. And the coverage of the HPV vaccinated child is not so high, but we think that during just 1 year, it's around 120,000 child is a good number. Children is a good number. And since 2012, we have started screening against the cervical cancer. And this cancer is the most diagnosed earlier cancer in Mongolia. But the percentage is just 50%, which is not good enough. I hope this training of the trainers of cervical cancer will give a good impact on the pushing of the cervical cancer screening. And starting of 2026, we're going to have a new policy on cancer screening. And of course, the cervical cancer will be the main cancer which should be screened, and spend a good budget for the government to reduce the deaths or late diagnosis of cervical cancer for women. As you know, we have a big land, big country, less populated, only 3.6 million people, and health system is very good organized with a good health infrastructure, and very vertical policies going on in whole Mongolia for health sector. So if we want training of the trainers, then it's easy to spread out the knowledge to the other doctors, other gynecologists or obstetricians to implement these your ideas to screen more women for cervical cancer. I appreciate that it's a first regional this kind of training in Mongolia, which started from Mongolia, and we hope we can be the good example for your training programs to spread this program to other countries. And we will try our best to implement what we have learned to all IMAX, all the units, to the World Health Organization and the local representative of the World Health Organization, Dr. Sakura, always supporting us and working together. And also the Embassy of Japan to helping, the supporting and giving some financial support to implement this program in Mongolia. And thank you very much to all organizers to find these monies to start in Mongolia. Thank you very much.